this patient was referred to me 1 year ago, a year ago, for endodontic retreatment of tooth number 19. According to the patient, the root canal was done by her previous dentist about 6 years prior. And here's the date, as you can see, a year ago. This is today's date. Patient has symptoms. So as you can see, crown on the tooth, previous root canal, periapical lucency here and here. Tooth was tender to percussion and palpation. Probings were 2 to 3 millimeters all around. So we discussed options with the patient, and patient wanted to try to save the tooth. So went through the crown and redid the root canal for this patient in one appointment. So take a look. This was immediately after we redid the root canal for this patient in one appointment. And again, here's the date. As you can see, a year ago. This is today's date. Now take a look. Let me show you multiple angulation PAs of the tooth. Okay. We just opened this tooth up and look at all of this anatomy. 4 completely separate canals. All right. So I redid this root canal for this patient in one appointment. I redid the root canal in one appointment. Went through the crown, redid the root canal in one appointment. Will that cause this root canal to fail? Would sealer extrusion cause endodontic retreatment failure? These are all the questions that I want you to answer. Or I'm going to answer them. I want you to think about. You can see the periapical lucencies here and here. So redid the root canal through the crown in one appointment, and you can see there's sealer extrusion. Okay, redid the root canal one appointment. Will that cause endodontic retreatment failure? Sealer extrusion, will that cause endodontic retreatment failure? And again, here's the date, as you can see, a year ago. And here is the 1 year post-op of the tooth. Patient has 0 symptoms. She still has the same crown that we went through to redo the root canal for her. The endo axis was restored by her dentist using composite. So as you can see, periapical lucencies have healed. Again, patient has 0 symptoms. She was very happy. So endodontic retreatment in one appointment did not cause this endodontic retreatment case to fail. And sealer extrusion did not cause this endodontic retreatment case to fail. And here's the date. Just the other day, yesterday, when she came in for a different tooth. And this is today's date, as you can see. So 1 year post-op of tooth number 19, endodontic retreatment done in one appointment did not cause this endodontic retreatment case to fail. And sealer extrusion did not cause this endodontic retreatment case to fail. Here are the radiographs, x-rays side by side. So you can see this was a year ago before we redid the root canal in one appointment. And here's the date. Okay. And this was just the other day, 1 year post-op of the tooth. You can see those periapical lucencies healed completely in 1 year. And that is today's date. All right. And when I saw the patient yesterday, that's the date from yesterday. All right. So 1 year post-op of tooth number 19, we redid the root canal in one appointment. That didn't cause, we redid the root canal in one appointment. That did not cause endodontic failure, and sealer extrusion did not cause endodontic retreatment failure. 1 year post-op of tooth number 19, patient has the same crown as the crown that we went through to redo the root canal for her. The endo axis was restored with composite by her dentist. 1 year post-op of tooth number 19, endodontic retreatment was done in one appointment. That did not cause endodontic retreatment failure, and sealer extrusion did not cause endodontic retreatment failure. I keep repeating this so you get familiar with what I'm talking about, where I'm going with this. You don't need multiple appointments for. The only reason you need multiple appointments is if you run out of time, you want to take your time, you run out of time, then you obturate the canals with calcium hydroxide, temporize the tooth, bring the patient back in a week, or if the canals are wet prior to obturation. Those are the times that you need endodontic. You need to do the endo or redo, if you're doing redo, in multiple appointments. But as you can see, I've posted hundreds of these cases. So 1 year post-op of tooth number 19, as you can see, the periapical lucency is healed completely. Tooth is in full function. Patient has no symptoms whatsoever. 1 year ago, and just the other day. And this is today's date. Excellent.